Welcome to the presentation on Midtown St. Petersburg Community Analysis, presented by Tracy Barber, Stacey Ann Cunningham, and Chamaka Obinka. Objectives: Overview, Community Analysis, Structure, Population, Environment, Health-related Resources, Government, Historical and Public Policies, Prioritize Community Problems, Global Issues.
The history of St. Petersburg began when General John Williams, a native of Detroit, Michigan, came to St. Petersburg in 1875. General Williams had a grand vision for St. Petersburg that involved land, streets, and the creation of parks. In order to achieve this dream, he purchased 2,500 acres of land. African Americans have had a profound influence on the city since the late 1800s. The historic Manhattan Casino used to be a dance hall where famous performers such as James Brown used to come and entertain the community. In the 1960s, the main library, Bayfront Center, and the Museum of Fine Art was built. In 1998, the St. Petersburg welcomed Tampa Bay Devil Rays to their permanent home at the downtown Tropicana Field. In the 21st century, St. Petersburg continued to grow. The residents invest into the city with great pride. They continue to build restaurants, movie theaters, and stores, as well as provide attraction to tourists. Majority of the houses in Midtown area is protected by zoning laws because of its historical significance to the Midtown community. Homeowners have to comply with zoning laws which prohibit dramatical modification to the structure. For most homeowners, the zoning law is important for the preservation of the historical community. For others, this can be an issue who may want to update their building in keeping with modern times. The surrounding houses around the community mostly consist of single-family dwelling, which designs are more in keeping with modern times. In the Midtown community, most of the roads are brick-laid compared to surrounding communities which the roads are paved. There are only two schools within the Midtown St. Petersburg. They are Jordan Park Elementary and Perkins Elementary. Therefore, students have to go to school in a 2.5-mile radius via school bus or the private vehicle. This can be seen as a disadvantage for members living in the community. The churches in the Midtown area consist mainly of Baptist and Catholic. So if a person is of another religion, they have to go within a 5.5-mile radius outside the community. Midtown St. Petersburg is a very diverse community. The population number over 22,000. 54.5% female and 45.5% male. The median age range is 33 years. Majority of the residents are Caucasian, consisting of 68%. African American comprise of 23% and Hispanic 6%. Majority of the residents are employed. The issue that this community is facing is that only 29% graduated from high school and 18.8% are considered middle class. In comparison with the population in the community, there is always going to be a concern regarding cardiovascular disease because it is the #1 cause of death among Caucasian. According to the Journal of Cardiovascular Nursing, the top 3 causes of death among Caucasian are cardiovascular disease, cancer, and respiratory disease. According to the assessment that was done, there was 2,653 deaths caused by cardiovascular, 2,460 in cancer, and 651 in respiratory disease last year.
Midtown has health resources for the residents living in the area. The formerly known Mercy Hospital was redeveloped into Johnny Ruth Clark Center in 1985 as part of the Community Health Centers in Pinellas Incorporated. The mission of the facility is to provide quality health care services to all and ensure that the services is provided with dignity at low cost to patients in the locations with times that are convenient for the population served. The main focus is to emphasize the health maintenance, prevention, promotion, and education and self-care. Services that are provided are family practice, pediatrics, women's health, pharmacy, prescription assistant programs, registered dietitian, and dental. The hours of operation of the center is Monday through Thursday, 8 a.m. to 8 p.m. and Friday, 8 a.m. to 5 p.m. There is also a neighborhood Walmart that has a pharmacy that is accessible to the community and offers low prices on health care needs along with groceries. The hours of operation is 7 a.m. to 11 p.m. and is centrally located for the convenience of the community with a bus route for transportation. Healthy People 2020 addresses topics and objectives that relate to community health. With this being said, 3 objectives that are applicable to the health of Midtown are adolescents, diabetes, and sexually transmitted diseases. Adolescent health objectives is to increase the proportion of adolescents who have had a wellness checkup in the past 12 months. There was a 68.7% of adolescents aged 10 to 17 who had wellness checkups in the past 12 months, reported in 2008. Rationale is to establish a person-to-person intervention and involve the caregivers to help with their parenting skills on risk factors for adolescents to modify adolescents' risk, protective health behavior, and health outcomes. Diabetes objectives: increase the proportion of adults with diabetes who perform self-blood glucose monitoring at least once a day. 64% of adults aged 18 years or older perform self-blood glucose monitoring at least once daily in 2008. Rationale: diabetes self-management education interventions are recommended in community gathering places to educate the community on improving their glycemic control for adults with type 2 diabetes and children and adolescents with type 1 diabetes. Sexually transmitted diseases: reduce the proportion of females and males aged 15 years of age with chlamydia, trichomatis infections. 12.8% females and 7.0% males have been tested positive in 2008. Rationales: provide education and interventions on a regular basis in the clinical setting for persons who have or are at risk for sexually transmitted diseases to help further reduce transmission of the disease. Midtown Community offers a local credit union for banking purposes and is located across from the Walmart supermarket. The Dollar General store provides needs for home, automotive, business, school, and more. St. Pete College has a Midtown campus convenient for students living in the area. Rick Kreisman is the 53rd Mayor of St. Petersburg. You can contact the Mayor with concerns or ideas via email, or you can complete a Mayor Appearance Request form for the Mayor to speak at appearances or events. The City Council have meetings on Thursdays. The public has an opportunity to speak, and if they don't want to speak, they can fill out a card. The meetings are very organized, and the public has the opportunity to speak for 2 minutes. And after the 2 minutes, the buzzer will go off. The issues of St. Petersburg and Tampa Bay areas: there's about 16,000 homeless people, with 1 of 5 being children. In Pinellas County, in 2012, there was about 225 families and 900 people were homeless.
6 overall community problems are listed according to their priorities. Heart disease is leading cause of death in Pinellas County, according to Florida Death Count Query 2013. 2,620 deaths were reported. I rank it for number 1 because it is number 1 health issue facing Midtown community. Lifestyle modifications such as low-fat diet, smoking cessation, weight loss, and increase in activity will help reduce the death rate of heart disease. Cancer is the second cause of death in Pinellas County. Florida Death Count Query System in 2013 reported that 2,522 deaths annually. I rated this number 2 because the statistic is very high in the community. Cancer can be prevented or cured if it is detected early. According to CDC 2013, more than 63% of Pinellas County adults are overweight. 29.5% to 33.5% of children aged 2 to 4, and 25 to 29.9% of high school students are overweight. I ranked obesity number 3 because obesity can lead to heart disease, diabetes, cancer, and other health problems. Lifestyle modifications such as good nutrition, daily exercise can promote good health. According to U.S. Census Bureau, 16.3% of Midtown residents are living below poverty level. I rated poverty number 4 because it can lead to poor health. Poverty is like a cycle that touches different aspects of life, such as limited access to health care, food, and transportation. The other issue affecting the community is sexual transmitted disease. According to CDC 2003, there was 4,080 cases of chlamydia reported in Pinellas County. I like it number 5 because most people in the community are sexually active. Health promotion should be done through education, prevention, and annual screening. According to Young and More, there are 3,391 homeless persons, of which 735 of them were children under 18 years of age in Pinellas County. Homeless is a problem facing this community. I rated it number 6 because the homeless people are prone to danger. As a nurse, we should advocate for shelter and medical needs for homeless.
Obesity is a major health problem affecting community globally. According to Shaw's 2010 report, 1.6 billion adults and 20 million children are obese worldwide. Obesity has been linked to so many health issues such as heart disease, diabetes, and cancer. Obesity affects 70% of men and 65% of women in Orkney, Shetland, and Western Isles, according to Scotland newspaper. All they are dealing with the issue of obesity through lifestyle modifications such as exercising, eating healthy, and psychological support to youngsters. In Midtown, St. Petersburg, we are dealing with the issue of obesity through programs such as encouraging healthy foods in schools and workplace, enhanced infrastructure such as Pinellas Trail to promote walking. As community health nurses, we can help decrease obesity by educating the community about the importance of making healthy food choices and exercise to decrease obesity rates within the community.